Think about the last time you were in the middle of a conversation with family or sitting in a quiet room and you suddenly had to stop everything just to clear your throat. That sticky, uncomfortable sensation that no amount of swallowing or coughing seemed to fix. And the frustrating part is it comes straight back within minutes. You have probably tried everything already. Warm teas, honey and lemon, steam over a bowl of hot water, antihistamines from the pharmacy. Maybe you got a few minutes of relief and then right back to square one. I hear this exact story from patients every single week, and I am going to tell you today that the reason nothing has worked is not because you have not tried hard enough. It is because almost everyone, including many doctors in a busy 12-minute appointment, has been focused on entirely the wrong thing. I am Dr. Michael Chen, and you are watching Healthy Aging Insights, the channel dedicated to giving men and women over 60 the kind of honest and practical health information that can genuinely change your daily life. Today we are talking about persistent throat mucus, that sticky coating that makes you constantly clear your throat, and more importantly, the hidden cause behind it that most people never discover. Stay with me all the way through because the explanation I am about to share is one of those moments where things finally start to make sense. Before we go any further, I want to ask you something. How long have you been dealing with this? Is it weeks, months, or has it honestly been years? Leave your answer in the comments below because I want you to know you are absolutely not alone in this, and the number of people silently struggling with the same problem might genuinely surprise you. Now let me start by clearing the air about something, because before we can address the real problem, we first need to dismantle the explanations that have been keeping people stuck for far too long. The first assumption most people make is that persistent throat mucus must be from a cold or some kind of respiratory infection that has just never fully cleared. I completely understand why that seems logical. Mucus, coughing, that constant need to clear the throat, it all sounds respiratory. But here is the thing. A common cold or viral infection follows a very predictable timeline. It peaks around day 3 or 4, runs its course, and is typically resolved within 10 to 14 days. If you have been dealing with this for more than a month, the virus explanation simply does not hold up. Something else is going on entirely. The second explanation most people land on is allergies. And yes, allergies can absolutely cause what is called postnasal drip, where mucus slides down the back of the nose into the throat and creates that constant coating sensation. But allergies tend to follow recognizable patterns. They worsen in certain seasons, around particular animals or environments, and they usually respond at least partially to antihistamine medications. If you have tried allergy treatments and the mucus in your throat has stubbornly remained 12 months of the year regardless of season, allergies may be a contributing factor, but they are almost certainly not the full story. The third explanation I hear, often from people over 60, is one that genuinely concerns me every time. People tell me their doctor mentioned it is just something that happens with age, and they have started to accept it. Now, it is true that our bodies change as we get older, and our mucous membranes can shift in ways that make the mucus we produce feel thicker and stickier. But waking up every single morning and spending 20 minutes clearing your throat before you can even begin your day is not an unavoidable fact of getting older. That is your body signaling that something is out of balance and it deserves to be taken seriously and properly addressed. Accepting unnecessary daily discomfort is one of the things I am most determined to help people over 60 stop doing. So, if it is not a cold, not allergies, and not simply something to accept as aging, what is actually happening? Pay close attention here because what I am about to explain is the missing piece that changes everything for most people. The answer for the vast majority of people dealing with chronic throat mucus begins not in the throat, not in the lungs, and not in the nose. It begins in the stomach. The condition has a long medical name, laryngopharyngeal reflux, and most people have genuinely never heard of it. You might hear the word reflux and immediately think of heartburn, that burning sensation in the chest. But here is what makes this condition so uniquely difficult to identify. Some research suggests that more than half of people who have this form of reflux experience absolutely no heartburn at all. No chest burning, no obvious indigestion, nothing that would lead you to point to your stomach as the source. That is why it is sometimes called silent reflux. And that silence is precisely why it goes undetected and untreated for so long. Let me explain what is actually happening using something we can all picture clearly. Your stomach is essentially a pressurized chamber that uses powerful acidic fluid to break down everything you eat. Between your stomach and your esophagus, which is the tube running from your mouth down to your stomach, there is a muscular valve whose entire job is to act as a controlled gatekeeper. It opens to let food travel down and then closes firmly to keep the stomach's acidic contents exactly where they belong. When that valve is not functioning properly, whether because of dietary habits, chronic stress, excess weight, certain medications, or simply the natural changes that come with aging, stomach acid can escape upward. But it does not have to be a dramatic rush you would notice. What travels upward can be extraordinarily subtle, almost like a fine acidic mist rising silently while you sleep, so gentle you never feel it happening at all. And this is where it becomes so important to understand. While your stomach lining is specifically built and designed to withstand that acid, your throat and voice box are not. They are exquisitely sensitive and delicate. Think of it this way. The difference between exposing a corrosive liquid to industrial concrete versus to fine silk fabric. Your throat is the silk. Even tiny, barely perceptible amounts of acid reaching those delicate tissues night after night create real and cumulative irritation and inflammation. And when your throat senses that it is under attack, it does the only thing it knows how to do to protect itself. It produces a thick protective layer of mucus as a defensive shield. That mucus in your throat that you keep trying to clear is not the problem. It is your body's protective response to the problem. It is your throat desperately trying to coat and cushion itself from the damage being done to it every single night. This is why no tea, no throat lozenge, no cough syrup, no amount of water ever truly resolves it. You have been addressing the protective response while the real attack continues uninterrupted underneath. And stay with me because there is one more piece to this picture that explains why certain everyday foods and drinks seem to trigger an almost immediate worsening of your symptoms. Stomach acid does not travel alone during reflux. It carries with it an enzyme called pepsin, whose normal job inside the stomach is to help break down protein in your food. When pepsin travels upward with the acid and settles onto the tissues of your throat, it can remain there quietly, almost like a dormant landmine, and then something activates it. Your morning coffee, a carbonated drink at lunch, a splash of vinegar in your salad dressing, orange juice at breakfast. Any acidic food or drink touching your throat can switch that pepsin back on. And once it is activated in a place where there is no food for it to process, it starts breaking down the protein in your own throat tissue. Your body responds by producing even more mucus urgently as an emergency protective measure. And the cycle perpetuates itself day after day, sometimes for years. Now, if you are recognizing yourself in what I am describing, if this is beginning to explain something you have been living with for a long time, please do share this video with someone else who needs to hear it. And if you are not yet subscribed to Healthy Aging Insights, I would genuinely love to have you join our community here because this is exactly the kind of information I share every week. Now, let me give you a practical plan. 10 strategies that directly target the real cause rather than the symptom. And now that you understand what you are actually dealing with, every one of these will make complete and logical sense. The first and most immediately impactful change you can make tonight is to elevate the head of your bed. Not just your pillow, but the entire upper portion of your sleeping position. When you sleep completely flat, you create a level surface between your stomach and your throat, and that acidic mist can travel upward with no resistance at all. Raising the head of the bed by approximately 6 to 8 inches allows gravity to work in your favor. The most effective way to do this is to place firm wooden blocks or wedge-shaped risers under the legs at the head of your bed frame. A specially designed wedge pillow that supports your entire torso is another excellent option. Simply stacking regular pillows only bends your neck and does not achieve the protective angle through your torso. Many patients report a noticeable difference within the first few nights of making this single change. The second strategy is to sleep on your left side rather than your right or your back, and this has a genuine anatomical basis. Because of the natural shape and position of the stomach, lying on the left side keeps the stomach contents lower and further from the valve. Lying on the right side does the opposite and can actually encourage acid to pool near the valve and escape more easily. If you are used to sleeping on your right side, this may take a few nights to feel comfortable, but it is well worth persisting with. The third strategy is what I call the 3-hour rule, and I consider it one of the most important habits you can establish. Whatever you eat or drink in the evening, including any small snack, should be finished at least 3 full hours before you lie down. Your stomach needs adequate time to empty before you go horizontal. When you lie down too soon after eating, you are essentially tilting a partially filled container on its side. Even something light close to bedtime can be enough to trigger overnight reflux. I have a patient I will call Margaret. She is 68 years old and had been clearing her throat every single morning for nearly 3 years before she came to see me. She had seen other practitioners who had focused entirely on allergy and respiratory causes without resolution. When I explained silent reflux and she understood for the first time where this was actually originating, I could see the relief on her face just from having an explanation that finally made sense. The 3-hour evening rule was the first change she committed to. Within 2 weeks, she told me her mornings had become markedly quieter. It was not the only change she made, but finally understanding what was happening gave her the confidence to follow through with everything else. The fourth strategy is making your evening meal the lightest meal of your day. Large, heavy, fatty meals take considerably longer to digest and create significantly more pressure inside the stomach. A lighter dinner built around lean protein, simply cooked vegetables, and easily digestible carbohydrates gives your digestive system a much more manageable overnight task and reduces the pressure that pushes acid upward while you sleep. The fifth strategy is identifying and temporarily reducing your personal trigger foods. The most commonly problematic ones include coffee and caffeinated teas, carbonated drinks, including sparkling water, alcohol, chocolate, peppermint, citrus fruits and juices, tomatoes and tomato-based sauces, vinegar, very spicy food, and anything particularly fatty or fried. Pro tip here, and this one surprises many people. Sparkling water, which seems so innocent and healthy, is acidic enough to activate pepsin on throat tissue. Switching to still water alone during a healing period is a small change that many of my patients find surprisingly effective. The sixth strategy is thoughtful hydration throughout your day. Staying well hydrated helps keep mucus thinner and easier to manage, but drinking large quantities of fluid with your meals fills the stomach more than necessary and can increase the pressure that triggers reflux. Sipping water steadily between meals, rather than drinking large amounts all at once, is the more supportive approach for your recovery. The seventh strategy is an alkaline morning gargle that takes 30 seconds and can noticeably ease that uncomfortable first thing feeling in your throat. Add a small pinch of baking soda to a glass of warm water and gargle gently for about 30 seconds before spitting it out. Do not swallow it. The alkaline mixture helps neutralize any residual acid remaining in your throat from overnight reflux and may help calm pepsin activity on those delicate tissues. It is not a standalone solution, but as part of a broader plan, it provides real comfort and helps create the healing environment your throat needs. The eighth strategy is chewing sugar-free gum after your meals, but specifically avoiding any mint-flavored varieties. Chewing stimulates your salivary glands, and saliva is naturally alkaline. As you swallow during the chewing process, it helps neutralize and wash away any acid that may have crept upward after eating. Peppermint and spearmint, however, are known to relax the muscular valve between the stomach and esophagus, which is exactly the opposite of what you need. Fruit-flavored sugar-free gum is the much better choice here. The ninth strategy is incorporating genuinely soothing herbal teas into your daily routine as a caffeine-free alternative to your usual hot drinks. Chamomile tea has well-recognized anti-inflammatory and calming properties and is one of the most supportive choices for an irritated throat and digestive system. Ginger tea made from fresh ginger root is another excellent option, as it has been observed in some research to support healthy digestive function and reduce inflammation. A warm cup of either after a meal is a pleasant and practical daily habit, and a small amount of natural honey added to either one provides its own gentle, soothing quality. The 10th strategy is managing stress with the same seriousness you bring to your dietary changes. I say this not as a vague wellness suggestion, but as straightforward physiology. Chronic stress directly increases stomach acid production and can impair the function of the valve that is supposed to keep acid where it belongs. Whether your means of managing stress is a daily walk outdoors, gentle breathing exercises, 10 minutes of quiet reading before bed, or time in the garden on a weekend morning, building something genuinely restorative into your daily routine is a legitimate and meaningful part of your recovery. Your nervous system and your digestive system are in constant communication, and caring well for one genuinely supports the other. Here is your clear action plan starting today and tonight. Tonight, commit to finishing all eating and drinking at least 3 hours before bed. If you can safely raise the head of your bed frame or look into ordering a wedge pillow, set that in motion today. Tomorrow morning, try the baking soda gargle when you wake up and pay attention to how your throat feels. This week, swap your morning coffee or caffeinated tea for chamomile or ginger tea just as a trial. Replace any carbonated drinks with still water. And at your next evening meal, see if you can make it lighter and earlier than usual. Start right there. You do not need to change everything at once. Layer these strategies in over the coming days and give your throat the time it genuinely needs to begin healing. One important warning I cannot leave out. If you are currently on any prescribed medications, particularly for pain, blood pressure, or digestive issues, some of these can actually contribute to or worsen reflux as a side effect. Please do not adjust or stop any medication on your own. Bring the term laryngopharyngeal reflux to your next appointment and ask your doctor directly whether this could be contributing to your symptoms. Having the right name for what you are experiencing is genuinely the first step toward receiving the right support and guidance. You have been living with this uncomfortable and disruptive problem for long enough. Now you understand what has actually been happening inside your body all this time, and you have a real and logical plan for addressing it at its source rather than endlessly managing the symptom. Your throat is capable of healing. Your body is more resilient than you might give yourself credit for right now. And that journey begins with your very next choice. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health. If you found this video helpful, don't forget to subscribe to Healthy Aging Insights and hit the notification bell so you never miss a health tip. See you in the next video.